Hello, I am Dr. Sai Praveen, Neurologist at Akkineni Hospital. Hope you are doing well. In this session, we'll discuss some crucial points. Stay attentive and make your notes.
Have you ever had a health issue that other people just kind of brushed off? You know, a headache that won't quit, a weird dizzy spell, or a strange tingling sensation. But you knew it was something more? Well, today we're diving into exactly that, the world of neurological health. And we're going to do it with the help of an expert who really knows how to break down these complicated conditions so we can all feel a little more in control. So let's start with a story that might sound pretty familiar. This is Lakshmi. She's a teacher. And for her, the day doesn't start with her alarm clock. It starts with a throbbing pain right behind her eye. The morning light feels like an attack, and the rest of the day is just about surviving. Her friends, her family, they mean well. They say, oh, it's just stress, or just drink some water. But for Lakshmi, this isn't just a headache. It's something that literally steals days from her life, over and over again. And this is probably the most important thing for anyone who sees themselves in Lakshmi's story to hear. That pain, that feeling, it's real. It is not some kind of character flaw, it's not you being dramatic, and it is definitely not something you just have to push through. It's a real medical issue, and it absolutely deserves real medical attention. You know, just having your experience validated, that's the first step to getting better. Okay, so when you've got these confusing symptoms and you need answers you can trust, you really need a guide. And that's where an expert like Dr. Sai Praveen comes into the picture. He's the neurologist whose work we're exploring today. So who is Dr. Praveen? Well, he's a consultant neurologist with more than 10 years of experience focused squarely on the brain and the nervous system. He has advanced degrees in internal medicine and then went on to get a super specialty in neurology, which means he has this incredibly deep level of understanding. Plus, and this is a big deal, he consults in English, Telugu, and Hindi, making sure that people can actually communicate clearly and comfortably about what they're going through. To really get a feel for Dr. Praveen's approach, let's go back to Lakshmi's story for a second. We're going to take a closer look at one of the most common, and honestly, one of the most misunderstood neurological conditions out there, the migraine. Right off the bat, the first thing Dr. Praveen makes crystal clear is that a migraine is not just a bad headache. Not even close. It's a complex neurological disorder. And get this, it's ranked as the second leading cause of disability in the entire world. Let that sink in. This isn't some minor thing you just take a pill for. It's a serious condition that involves your brain, your nerves, and this whole cascade of chemical reactions. Now, what's really fascinating here is that a migraine isn't just the headache part. It's actually a whole event with 4 distinct phases. It can start hours or even days before the pain hits, with something called the prodrome. You just feel kind of off, maybe tired or irritable. Then, for about a quarter of people, there's the aura, seeing flashing lights or weird patterns. Then comes the headache itself, that throbbing pain that can last for up to 3 days. And even after the pain goes away, you're left with the postdrome, which is basically a migraine hangover that leaves you feeling totally wiped out and foggy. Understanding this whole cycle is a game changer for managing it. So you might be wondering, why do women get migraines so much more often than men? Like 3 times more often? Well, there are a few big reasons. Hormones are a huge one. Drops in estrogen can be a massive trigger. There's also a really strong genetic link. So if your mom or your sister has them, your chances are higher. And then you've got lifestyle factors, right? Chronic stress, not sleeping well, certain foods, and even just simple dehydration. They all play a huge role. Now, while migraine is a perfect example of his approach, Dr. Praveen's work covers a much, much wider spectrum. So let's zoom out a bit and look at the whole range of services and diagnostic tools he uses to get a complete picture of a person's neurological health. This right here is the heart of the practice. Dr. Praveen handles everything from epilepsy and stroke management to vertigo and nerve disorders. But here's the crucial part. It's not just about treating symptoms. It's about using specialized tools to find the cause. An EEG, for example, looks at the brain's electrical activity to understand seizures. Tests like NCS and EMG check how well your nerves and muscles are communicating. It's this powerful combo of clinical know-how and advanced diagnostics that leads to the right diagnosis and ultimately a treatment plan that actually works. When it comes to your health, knowledge really is power. Just knowing what to look for, knowing when to ask for help, can make all the difference in the world. So let's talk about some of those key warning signs. So let's circle back to that headache one more time. If you've ever found yourself wondering if these aren't just normal headaches, this next part is for you. It's a pretty simple way to check. Okay, I want you to think about your own headaches for a second. Does any of this sound familiar? Pain that throbs or pulses? Is it so bad that it just knocks you out for the day? Does it get worse if you try to do something simple, like walk up a flight of stairs? And does it come with nausea, or does light and sound just feel unbearable? If you're nodding along to 3 or more of these, there's a very good chance it's a migraine, and it's absolutely worth talking to a neurologist about. And now for something that is incredibly urgent. Knowing the signs of a stroke can literally save a life, maybe even your own. The easiest way to remember it is with the acronym FAST. F is for face. Is one side drooping? A is for arm. Can they raise both arms or is one weak? S is for speech. Is their speech slurred or strange? And T? T stands for time. It means time to call for emergency help right away. Every single minute counts. So, once you've recognized the signs and you've decided to get help, what does that path to feeling better actually look like? Well, it's not about finding one magic pill. It's about creating a personalized strategy that's right for you.
When we're talking about something like migraines, treatment really falls into 2 different buckets. You've got your acute or rescue treatments. These are what you take during an attack to stop it in its tracks. But if you're having these attacks all the time, the goal changes. That's when you move to preventive treatments. These are medicines you take regularly to make the attacks happen less often and be less severe. It's this 2-part approach that really helps people get their lives back.
So, for anyone in or around the Vijayawada area, here is how you can take that next step. This is the contact information for Dr. Praveen's practice at the Akkineni Wellness Center. You'll see a number for regular consultations and a separate, really important one for 24/7 emergencies. Let's just end on this one thought. Think about how many people, just like Lakshmi from our story, are told to just rest, to just push through it, to accept their pain as a normal part of life. But what if we decided not to accept that? What if we actually started treating our health like it's the most valuable thing we own? Because let's be honest, it is. Recognizing the signs, seeking out an expert, and getting a real diagnosis, that's not weakness. It's the smartest and most powerful investment you could ever make in yourself.